Hey there, Digging Deeper audience. Well, it is another special edition here on the Digging Deeper. You are going to see some familiar faces, but we do have a new face to the podcast. And so real quick, the heart behind this. We here at River Valley, we just pride ourselves in being in the community for the community. That's our motto. That's the heart behind what we do. So in our community, when big topics come up, when big things come up, we have two choices as a church. We either be ignorant or we try and address it head on, and we try and get information from the horse's mouth, so to speak. We did it with social justice when it was big, and it still is. I Resolve. And today, the horse's mouth is a doctor, and Dr. Rick Williams. I asked permission if I could call him the horse's mouth, and he said yes. So today, we are going to be discussing the vaccine. And a quick disclaimer before we introduce our guests. This is not River Valley's staunch endorsement either for or against the vaccine. What this is a discussion. This is a discussion between some pastors and a local doctor, all brothers in Christ, just talking about this vaccine. We're going to talk about how it's affected our community. We're going to talk about some misconceptions or just talk about the vaccine in general, and then how we can trust our sources. So listeners, if that sounds like something you're into, go ahead, hang on. It's going to be a good ride. To my right, we know the boys, Tyler and Austin. How you guys doing?
Good. Yeah, I'm doing great, man.
Awesome. And to my left,
Am I the old man?
No, you're the horse. The horse's mouth.
The horse with a name, and that's Dr. Williams. Dr. Williams, go ahead and introduce yourself. Just how long you've been around here, your family, and
Yeah. I'm Rick Williams. I'm a family physician. I've been here 25 years. We moved 25 years ago in July, and I started my practice in September. So I'm coming up on finishing a 25th year in practice. I probably had Tyler in Team Kid years ago.
Yeah.
Down in the basement somewhere, and probably saw Austin on the soccer field, played for TNT, right?
That's correct. Yes, sir.
And I clearly missed the dress code today because
I was going to say, if you had to pick the doctor out of this group,
right.
obviously be Dr. Williams.
But I'm honored to be invited to such a young and cool audience. So I feel like you've really brought me in, right?
First round choice, man.
well, yeah, let's see if you agree with the cool afterwards. But we're excited to have you as well. You were my doctor for a period of time as well. Some of the good years. So.
I thought I saw you at one point.
Yeah. It was
So a little bit more. I have 3 kids. They're all adults. I have 1 daughter-in-law now. We just got married. Jonathan and Kara just got married this summer.
Wow.
I share practice with 3 other physicians, 2 of whom go here to River Valley. A couple of our nurse practitioners as well are believers, and my other partner goes to Edgewater. So I'm going to try to present kind of a Christian perspective. How do you blend a Christian faith, practicing medicine, science? What is this vaccine about? What's the COVID situation here locally, which is really quite alarming. But first thing, can I share a few first things first? I wanted to kind of frame the discussion in terms of, God cares about our physical health. I came across a verse, Jeremiah, "Behold, I will bring health and healing. I will heal them, reveal them to abundance of prosperity and security." Jesus says, love your neighbor as yourself. We're going to love each other despite maybe we disagree about things. There's been a lot of division, of course, in the United States, even in the church, over multiple issues in the last 18 months. So love one another. A truthful witness saves lives, according to Proverbs. Paul says we live in an imperfect world. We're going to talk about science. Science is not perfect. Paul says, the perfect will come. Knowledge is imperfect at this time. We know in part, 1 Corinthians 13. And God clearly advocates for the vulnerable, and we're going to talk about some vulnerability today. That's a clear biblical principle. So, and he asks us to serve others. So that's kind of where I want to frame our discussion, so that whatever side of the discussion you're on, you can be included and we respect each other. But I'm going to say that I'm going to take a stance that we really need to be thinking about our community in an active way, and I'm going to talk about the vaccine in that context.
Okay.
That's great.
Yeah, and before we move on, I just think that's huge in all the conversations we've had where some of the biggest breakthroughs or some of my favorite conversations I've had with people aren't when I was right, but when you've seen love kind of shown on both sides of a disagreement. And unfortunately, we're just seeing so much division in our conversations leading up to this. There's just so much division. Like this idea, the conversation around the vaccine is bringing division in families. And so I'm hoping that even this today can just be a small tool of different perspectives. that maybe don't see eye to eye, but kind of talking about that with the main goal. So before we kind of move on to the impact on our community, you guys have any questions for Dr. Williams?
Well, I just want to commend you, Dr. Williams. I know a number of people in our church who have been in your office in real vulnerable times. A guy I'm thinking of right now is on hospice, and he's probably not going to live very long. And just the words that he had to say about you and you praying for him, I'm just so impressed by you guys at Mountain View and the way you integrate your faith with medicine. So we appreciate you guys, and
Thank you.
Thanks for what you're doing.
Thank you.
Yeah, and also to kind of second that, just coming on something like this, I think takes a certain amount of courage because, I mean, like you said, this topic is incredibly polarizing, and whether we like it or not, there have been divisions that have been made, and at times those divisions can get incredibly toxic and mad, and so I appreciate you coming on here and being able to, voice, your point of view, and I think that's incredibly valuable. So
Yeah, well, I've been trading emails back and forth with Tyler initially, and I think that's how this all started. So I appreciate you guys really, being willing to talk about this, because it's a challenging topic. If the church, doesn't take things face on, then we become irrelevant.
Yeah, absolutely. Very well said.
Just like our I Resolve podcast, there might be a question that we ask, and Dr. Williams just can't for a number of reasons. Can't answer it. And so whether it's HIPAA or just another reason, so it totally has the freedom to say, can't answer that, move on, and we're all going to enjoy the awkward transition. So just letting the listeners know that. But so let's just go into the last 18 months. I think, we hear so much, and we're reading stories, and we hear stuff from the other side of the country, but there is some very devastating, powerful things happening in our community. So to whatever degree you would like, Dr. Williams, maybe just speak to the impact this has had in the medical field, the state of the hospitals right now. Like, how bad is Josephine County looking?
Yeah. Well, I'll start back with my first experience with someone dying of COVID. She was in her 50s, pretty healthy. I saw her once or twice a year. She got it before vaccines were available. First week, not that sick, at home. Second week, gets sicker, goes to the hospital. At the end of the second week, she's getting worse. She's put in the ICU. She gets on a ventilator. After a week on a ventilator, her 22-year-old daughter had to decide to terminate her life support for her mother. I take care of that daughter as well, and so I've seen her since then. That's hard. That's hard to see when these are people who shouldn't be that sick. Now that was 8 months ago. That was a while. Since then, we've seen a lot more. I've seen other older patients. I've seen younger patients. I was talking with one of my nurse practitioners today. She had a woman in her office who was in her 30s and got out of the hospital relatively recently. She said, "I will never underestimate COVID again." That was a healthy 30-ish person who is, from practicing 25 years, you don't see people that age in the hospital unless they're in a trauma or something really unusual. So clearly this is an illness that has changed. I mean, even in the last 6 weeks. I've had patients who didn't get that sick. Maybe they're mid 40s, didn't get that sick, but 6 months later they're still having chest pain, shortness of breath. I've done a bunch of tests, can't find anything, can't pin it on. That's called long COVID. So that's someone who still has COVID symptoms, but they're disabled. I mean, this person was a runner, now a walker. I had one of my partners has someone he knows who got over it, but was trying to read a book recently. He said, "I felt like I was slogging through studying for the SAT." Just kind of this brain fog.
It's not a good feeling.
No, that's how I feel when I read normally, but still, that's...
You've heard about the smell loss. Some people have lost the sense of smell for months at a time.
Yeah.
They're not that ill. They can survive, but that's not good.
Taste.
I had a patient who had a mild COVID. 2 weeks later, comes in with a blood clot in her lung, potentially life-threatening. She got through it. We treated it. So, you're hearing a lot of statistics of the deaths, and I'll kind of address the current state. And these are things that have happened over the last 8 months. COVID is an unusual illness, no question. There's been a lot of skepticism about it. Does it really exist? I take care of patients in the hospital. I've seen patients. My partner, I haven't been in the hospital the last week and a half or so, fortunately, so my patients have remained healthier for the last week and a half, but my partner said, I'm seeing someone who's in their 30s struggling to breathe. That shouldn't happen. So, and again, we're seeing now with this Delta strain, which has really changed things. If we had had this conversation 2 months ago, it would be a different conversation. Hospital, I was in the hospital about 6-8 weeks ago. Like, gosh, we are getting through COVID. I mean, it was at one point in December, it was all an entire ward. I was seeing patients on that, but now it kind of trimmed down to 3, 4, 5 beds in one little corner, plus a few in the ICU. I'm like, gosh, we were getting through it, as we all felt, right, until Delta came around. So since then, I think it was, I got some statistics from Wynn Howard, who spoke at a meeting I was at last night. He's the CEO of the hospital. In the Asante system, or actually in the Rogue Valley, I believe in mid to third week of July, 32 patients with COVID in the entire valley hospitalized. That number today in the Asante system is 180, plus whatever is at Providence. I don't have the access to that.
Today's August 24th.
So we're a month later, and it's gone up sixfold. They have 19 people today in the Asante system on life support.
Wow.
40-some in intensive care of some sort. Most of those, sadly, are unvaccinated. They're talking about anywhere, it shifts. I mean, there are some vaccinated people who get sick. It's shifting anywhere between 91 and 100% at any given unit, any given time, not vaccinated. And that's why I'm here to talk about the vaccine. In addition, the current state, they're in the process of converting their outpatient center, where you see patients in clinic, to an inpatient facility. They're using the post-anesthesia care unit where, normally you have surgery, you recover for an hour, then you're out. They're using that as hospital rooms. They've limited their surgeries. I was talking with a surgeon last night. He has patients who need a surgery to potentially protect them from having another stroke. He can't necessarily do that surgery. In the Mail Tribune this morning, there's a published story from a retired emergency room doctor who I worked with for years. He had a heart attack, and he was on his way to the coast. He could not get an ambulance. His wife called, hey, can you pick my husband up? I think he's having a heart attack. I'm sorry, there's no ambulance to pick you up. So she rushed him to the hospital. This is all in the Mail Tribune. You can read the story. He had to sit in the hospital. He needs to be admitted to the hospital, but there's no beds in the hospital, so he's in the emergency room. I was in there a couple weeks ago talking to one of the ER doctors I've worked with for years. He said, the other day was the worst day of my 30-year-plus career.
Wow.
And they have 35 beds in the ER. At that point, 25 of them were being used by inpatients. So there's really 10 to 15 beds that they're using for the regular, hey, I got an emergency.
Sure. Car crash,
stuff like
that, yeah.
Serious illnesses that can't necessarily. So we are now facing not only what COVID does to people, but what COVID does to systems and what COVID does to access to health. I mean, we're not in an underserved area. We have good health care here.
Yeah.
But right now, there's no guarantee that if you have a heart attack, you'll be able to get a bed or a bed promptly or an ambulance. And that's the reality we're in. So that's why we're at what my partners and I would consider a crisis.
And being 2 weeks away from having a wife who's going to be going to the hospital to deliver a baby, the state of the hospital definitely kind of concerns me a little bit. But yeah, no, and I think that's one of the goals here. And again, we're going to get into a lot more, but just hearing the real stories. Those are real stories from real firsthand experience, and so and more of those stories might come up. But just shows the state of our community, and it is not the best place right now. Do you guys have any questions? And even Dr. Williams, if you have any more thoughts.
Maybe I'll just address. Again, I said if we had been discussing this 2 months ago, it would be a different conversation.
Sure. Because we thought we were.
We thought we were through it, right? Delta has come around. Delta has really changed this. There's a scientific term called the R0 value. If you've read any articles on COVID, the R0 value is like if I get COVID, how many people do I spread it to?
Yeah.
It was 1 to 3, kind of depending on in the typical alpha variant, what they called. It's now 5 to 8. So now you have a lot more infectiousness, a lot more contagion, and of course that means that more people get infected. And because we live in a county that's has a lower vaccination rate than other places, what I think of this like is it's a wildfire. I was in Colorado earlier this year, visiting Rocky Mountain National Park. I've gone there for years. Beautiful. Well, a lot of that forest has burned. Why did that burn? Partly it was a weakened forest. It beetle kill for 10 years ago or so. So there's a lot of dry trees. It blows through there. So in that process, you don't have a healthy forest. So some of those healthy trees got burned along with the dead ones. So we have a vulnerable population because we have a lot of people who are unvaccinated. If you're unvaccinated, you are not protected against COVID. So when that goes through and a lot of people get it, there's a lot of virus circulating, and when there's a lot of virus, that can even overcome the immune systems of people who have been vaccinated. And that's kind of that's the worry right now. Is right now Delta has changed the playing field entirely.
Okay.
And that's confusing, right? I mean, we just June 30th, governor said, "Hey, go back to life," right?
Sure.
Right? And people are frustrated with why do they keep telling us this and then that and then this? If you're in a football game, do you keep the same strategy the whole time? If you're in a war, do you keep the same strategy? You adjust, right?
Yeah.
So, and that's this is unpredictable.
And at the time of this recording, August 24th, the governor just today had an outdoor mask mandated that for outdoor masking, which is fascinating.
Yeah, you couldn't pay me enough to be a state governor or a school superintendent right now, I don't think, because it is wild. And, with that.
Can I say one other thing? Pray for our leaders.
Yeah.
Yes.
That's something that like I say, I don't envy them.
Yeah.
Right.
When it's hard enough to make some of these decisions for yourself. Well, if you're thinking you're making responsible decisions for a community, a school district, whatever it is. So.
No, that's big. I remember before the election, before there was a winner of the election, I put a sticky note on my desk that said, "Pray for our president. Whoever it is, they're gonna need our prayers." And the same can be said in the local, community and state as well. So. Now shifting into where I really think we're going to spend probably 50 to 60% of our conversation is kind of that playing field. There's just, and I'm going to say this more than once, there's so much out there. There is everything ranging from the conspiracies, the aliens brought COVID, whatever. We're not going to dig too much into those, but there's just so much information. And so there's two things I'm wanting to get out of this next part of our conversation. One, what you are hoping listeners, and maybe we can start with this, what you are hoping listeners can know about the vaccine. And then two, and maybe where I can get some help from you guys, is just concerns, whether they are, logical or not, concerns that our listeners have about this specific vaccine. And I know we're going to talk about this specific vaccine and vaccines in general. But Dr. Williams, maybe a few minutes, you have the floor. I think maybe what would your kind of biggest push be knowing for people getting the vaccine, or about the vaccine, I guess?
First, I want to say that I apologize for that. That's a downer. I just spoke that's a real.
Oh.
I listened to someone basically Win Howard last night at a meeting telling us all those facts, and he went into a lot more detail. It was really depressing. So I'm sorry to bring that.
I mean,
but unfortunately, that is the world the community we're living in.
It's reality, right?
I think
it's reality.
I think the fact is that many medical professionals would say this is their worst day in their career has probably been this last year. So it's a reality.
I also appreciate you saying that, because I think many people probably view maybe the headlines of CNN, Fox News, but as far as local stuff, what's going on, some people may be in the dark per se. Right. So no, it's good to know what's going on, boots on the ground.
So the good news is that we do have an opportunity to fight this. I mean, there are multiple ways, and I appreciated Austin bringing up earlier. We talked about lifestyle medicine in this church a couple years ago. Dr. Hammond came in, presented, our ability to affect our health through the choices we make.
Yeah.
Whether that's exercise, diet, eating well, avoiding smoking, those kinds of things. I tell patients about that all the time.
Yeah.
And that's multiple layers. I mean, no one who, you can't guarantee if you exercise every day, you're going to live till you're 100. I mean, there's no guarantees in life, right? So I'm not going to pretend that if you wear a mask or if you distance or if you vaccinate or whatever, you're never going to get COVID. There's clearly people who are getting it. But those are on a lifestyle perspective. I tell patients that every day. These are things that can help you live longer. No guarantee. Just like if I get in a car, I have no guarantee I'm going to arrive at home. Totally. Even if I put my seatbelt on and drive safely. So that being said, we have a vaccination, or we have multiple vaccinations. And our office, well, first off, from my own perspective, I got the vaccine as soon as I could in December. I potentially am more vulnerable because I'm seeing sick patients. But I talked with our office staff. We've been masking for 18 months. I've been living in a mask every day at work. And we have not had one case that we know of that actually happened through work. We've obviously seen a lot of COVID patients.
Wow.
But we have not had one transmitted within our office. Now, we're masking full time. So from my own story, masking works. Studies show masking works as well. But we've been giving vaccinations. Back to I was going to mention my family. So all my adult children have been vaccinated. My siblings have all been vaccinated. Their spouses and their families have been vaccinated. My wife's family, all her siblings, spouses, her father, my parents. So we have 35 people we counted in our two families, age 15 to 91, all vaccinated. So, and no one's had any serious reactions. Obviously, this is just an 8-month situation at this point, but we feel very confident in that. My partners have been vaccinated. Many of our employees have been vaccinated. We've given 1,600 vaccinations in our office. We've had a few who've had some reaction, a rash or something where they felt uncomfortable getting a second vaccination if they were getting the mRNA vaccination, the Moderna. But we've not had any life-threatening or hospitalized reactions, 1,600. So that's here in our community.
That's great.
Those patients that we're giving to. There's no question the vaccines work. In the initial studies, 95% effective. Now, we're in a different environment right now. Delta is more contagious. There are more breakthrough cases than there were 2-3 months ago. Nevertheless, clearly the vaccine, studies have shown that they did a study of 4,000 healthcare workers who had either been vaccinated or not, and they compared people were sick less, so about 6 days less illness on that study, 2.5 days less in bed. So some of these people weren't that sick, they weren't hospitalized necessarily, but they were less ill. Of course, the sooner you get over it, if you're 6 days ill, 6 days less, you are going to hopefully pass it on to fewer people. If you get COVID right now, there's several threats. One is to yourself. Another is to your loved ones in your family. Another is to the people you work with or the other people in the community. The fourth is to the healthcare system, which we've kind of talked about, the healthcare providers. People are stressed in the healthcare setting. They are overworked, and it's a very difficult time. So not only can we help ourselves and our neighbors and our family, we can also help our healthcare workers by not getting ill. And again, the best way, in my opinion, of not getting ill from COVID or reducing your chances is being vaccinated.
Okay. Now, I apologize because I was thinking about something. You might have already said this, but maybe a reiteration. You say the vaccine works, and I know there can be some confusion, and this literally might be repeating what you just said. It works preventing you getting the disease in itself, or spreading it, or getting worse symptoms?
Well, it at various times has done all of those things.
Okay.
So people who have, first off, studies have shown that people who do get a breakthrough case with Delta are spreading a similar amount of virus. So we don't really know why that is. That didn't seem to be the case originally. But you have less likelihood of, first off, less likelihood of getting it. Second, less likelihood of getting seriously ill with it. And third, less likelihood of dying if you're vaccinated. Like I said, if you look at the hospital population, seriously ill people, 91+% are in our local healthcare system are unvaccinated, and it's worrisome. I mean, it's worrisome.
Okay.
But the vaccine, and there's questions about how were these vaccines? How these things come up so fast, right? Like, is this some conspiracy? Like this was this like an opportunity to market this or? So I did some looking at that. mRNA, if you're not familiar with, is a component of genetic material that's a translation from the DNA in the nucleus made into RNA, which is then coded into proteins. So in the mRNA research, it started in the mid-'80s, mid-'90s. The concept of mRNA vaccinations came up in the late '90s, and they weren't very successful initially, but they had a pretty good technology. And so over the course of the last 15 to 20 years, there's been research into this. And so because mRNA vaccinations, and I referenced Francis Collins' podcast. He's the director of NIH, also a believer. He talks about this being an elegant mechanism. So it's really, that's a cool scientific discovery. And just as an aside, I think that's one of the great things God gives us solutions. And so we have the opportunity to take advantage of that. And that's the way he perceives it.
Okay.
So anyway, the mRNA has been in the works. And so when it came up like that, people said, well, what the heck? How did this come up so fast? This doesn't seem right. Well, it's because our government, our National Institute of Health, have been investing in this kind of research for a while. And so now we're prepared.
Okay. Well, with that, I really appreciate it, and I kind of want to, and getting help from this side of the room as well, kind of addressing some of these concerns, or because I'm hearing things that you've said, and I've from other people heard the exact opposite, and so maybe taking a few minutes to discuss that. All right, so now hearing from the boys, Tyler and Austin, just this time to discuss what are some of the concerns or some of the pushback on vaccines that you guys have heard.
Want to go first?
You go first.
All right. So, thank you, man. So, I really appreciate everything you're saying, Dr. Williams. Some of you may have seen this back in May. There was in Rio de Janeiro on Christ the Redeemer. There was the words "vaccines save" on Christ the Redeemer over in Rio de Janeiro in Brazil. And I thought that was somewhat funny because 100% of people that take vaccines will die, and 100% of people that don't take vaccines will die, right? We're all going to die.
Right.
That sounds kind of brutal to say, but that is the reality of the human condition. That we're all going to die. With that being said,
Wait a minute, I went in the wrong career.
I know, right?
Technically, the unvaxxed has a little up because I don't think Jesus got vaccinated, but we don't need to get into that.
Well, no, and the reason I bring this up is because I do think that this is an important topic specifically. This is a church podcast because the idea, and what I'm seeing a lot, is that this vaccine is somewhat of a savior, and the way I'm seeing it being viewed is as that, a savior. And while I totally agree the vaccine is safe, I guess maybe I should just lay my cards
Go for
out.
it, yeah.
Is it an idol?
Bingo. And I think that's a very good question. I think that what we're seeing now is this undue worship and looking towards the vaccine, that it is going to save us and it's going to solve whatever problem we have in our life, and that's something that I'm noticing, which is kind of dangerous. And as from a pastor's point of view, that's what I'm noticing. Now, you can say that with anything, though. That's just not a vaccine.
We see it every 4 years at the election.
I was just going to say,
Yeah.
You just referenced the podcast you did earlier, the social justice one, the I Resolve one. This isn't just picking on the vaccine. This is common cultural issues. People get on their hobby horses and they ride them for a long time, and at times those good things can turn to God things. So I guess here's kind of how I'll lay out what I'm saying. I'm not an anti-vaxxer by any stretch of the imagination. I appreciate what you said about how the vaccine is somewhat a modern day miracle, and how I completely believe that God has given man wisdom and knowledge to be able to create life-saving things to preserve life. I think that's an incredible thing. I'm a major fan of modern day medicine. I would much rather be alive today than during the Black Death or the Black Plague or whatever. I would much rather be alive today than then. So I'm not an anti-vaxxer. I'm definitely for it. I've even spoke to my parents. They're both older. They both have some health issues. And I spoke to my mom yesterday, just saying, hey, you guys should consider getting this vaccine. It appears to be incredibly effective against COVID. Like you said, 95%.
In the original studies, yeah. In real life, it's been a bit below that, especially with Delta. But sorry.
Oh, yes. No, you're good. Yeah.
But right, we don't see vaccines with that kind of efficacy or effectiveness.
Yeah.
In my career, I usually say, well, you got flu shot, 67% shingle shot here. 95% effective in studies is quite remarkable.
Totally. Yeah, and I affirm that. I think that that's something to really take into account. Some of the areas that I do want to bring up with you. So I think probably the reason I'm even on this podcast. So you shared your vaccination stats. I'll share mine. I'm unvaccinated, and so I wrote down some reasons as to why. And I think the objections that I have to the vaccine are characteristic of, I think, a lot of people's views towards not getting the vaccine. And so I wanted to read some of them to you. I just wrote them down. So the first one is that I've already had COVID. I had it. I was out for about 6-7 days. I stayed in my house. I was very sick. I healed. I feel great now. I feel strong. And I remember growing up, chickenpox parties were a thing.
Right.
I remember, one kid in the
Second grade.
class.
I had in second grade.
In second grade, yeah. Kids in class have chickenpox. You all pack over to his house. Everybody breaks out. A few weeks later, you're good. And so, in my mind,
We're going to get shingles.
right. And so I know that, again, God created our bodies in such a way to be able to create defenses against foreign substances that seek to harm us. Our immune system is an incredibly intricate and beautiful thing. And so that's one area. And speaking on the mRNA things, I actually was reading on the CDC's website, and I found this interesting. And I would love for you to kind of help unpack this, help me understand a little bit more. Because, the mRNA thing looks pretty remarkable, but it says this: our immune systems recognize that the protein doesn't belong there and begins building an immune response and making antibodies, like what happens in our natural infection against COVID-19. And so I guess one question that I would have for you is, what is the difference between getting an mRNA vaccine, which appears to be designed to mimic what our immune system does, and then having COVID and knowing that your body has created a defense against said variant?
So I've had patients ask me the same question.
Yeah.
I've had COVID. Should I be vaccinated?
Sure.
Up till that, this recommendation from the CDC is still to be vaccinated. But over the last several months, they said, hey, if you had COVID, you should get vaccinated. I was not familiar with data that clearly demonstrated that until about 2 weeks ago.
Okay.
So they had a study of COVID patients. Some of them went on to get vaccinated. Some of them went on to not get vaccinated. And they studied breakthrough cases, or a second, either breakthrough vaccine or secondary cases. They got it again. The people who had COVID then vaccinated had about a 2.3 times less chance of getting a second COVID than the COVID patients who didn't get vaccinated. So now, does that mean that if you get COVID, you're going to get it again? No, but there's a potential chance.
Sure.
Is a natural immunity protective? No question. Is it protective for long? We don't know how long. Does there appear to be some benefit to vaccination after COVID? There's early data that says yes. So at least that's my understanding in the last, but that's relatively new information. So, when I'm telling people, it's sort of like, do you want to do everything you can, or are you going to? Certainly, absolutely, we rely on our immune system to fight off what we had before. In many cases, and that is protective for COVID. Mm-hmm. It doesn't appear to be as good as COVID plus a vaccination.
Okay, interesting.
In the recent studies.
Yeah.
Oh, I was going to say, and kind of along those lines, one of the objections, fears that a lot of people have, I'm sure we've all heard, is we don't know anything about the long-term results
effects of the vaccine.
Exactly, and I'm sure you're hearing that all the time in your office. What do you typically tell the people that have that fear?
When I went to get my vaccine, I'm human. Did I have that worry? This is an emergency authorization use, which I can explain a little bit. By the way, Pfizer's been approved yesterday, if you don't know that. So hopefully the FDA approval will encourage people that this is a good thing. But anyway, did I have some fears? I'm human. Was I willing to put my money where my mouth is? I practice medicine every day, right? Okay, if I'm going to be a Christian and I'm going to say, well, yeah, I believe Jesus up to that point, but I'm going to reserve this for my own decision making. I got to put my money where my mouth is if I'm a believer, and I got to put my money where my mouth is as a physician. Yeah. And I believe the science, and I read it, and I was a molecular biology major in college 30 plus years ago.
Who's counting?
And so the science is elegant, as we talked about. So, but do we know the long term? No. Do we know what's going to happen 2 years after COVID? No. So we don't. So you have two unknowns.
Yeah.
But if you have COVID, there's a higher risk of serious illness.
So you're saying we don't always know the long-term effects of COVID either.
We don't know the long-term
Right,
effects.
so, I
we
mean-
don't. We only have 18 months of experience.
Sure,
So,
sure.
So we don't have long-term data on either end of that. So that's the way I see it. So yes, you're accepting a risk of a long-term side effect. If you get COVID, you might die. You might pass it on to your family member. We had someone who visited their family member, elderly family member. This person had not gotten vaccinated, gave it to their elderly family member. I wouldn't want to. That's a stressful situation for that person who passed it on to their parent. So anyway,
Yeah.
the point is we don't know what's going to happen if we get COVID. We don't know what's going to happen if we have the vaccine long term. So it's a 6 of one and a half dozen other potentially.
It's a risk. It's a risk.
But the
calculation.
short term risk is clearly higher with COVID infection.
So that's actually one thing that I want to bring up. So I 359 million vaccines have been administered in the U.S., which seems kind of
In the U.S.? Oh, because of two.
I think because it's 199 million people have been vaccinated
Okay.
up till now. But
I'm like, we don't have that
Some of
many
those are-
people.
Yeah,
some of
so-
those are double. And I think it's. I got statistics from our public health officer, who's also a believer in
Yeah.
town. 2.5 billion in the world. So
Yeah. So
Wow.
60.2% of the population has received one dose, and 51.1% of the population has been fully vaccinated. So that's significant. And so I guess another question I had for you is there any shortage in vaccine? Is there any? Is there any? Is it readily available for people who are unvaccinated to go and get the shot?
My understanding is that there's more vaccine than there are people who want to have vaccine at this point. Of course, early on there were shortages; it was being rolled out, et cetera. At my office, I don't think we've ever run out since we started giving them in February or late January. I can't remember.
Sure.
So we're giving Moderna or Johnson & Johnson. So there's a couple options for people. But as far as, and I don't keep track. I can't comment on if pharmacies or Asante or anyone else
Sure.
has run out or anything like that currently. But my understanding is there's plenty of vaccine available.
Yeah, and to kind of add on to what Tyler was saying as far as the long-term side effects, I appreciate that you're saying, you're human. You think about that. For me, I do as well. I guess another objection that I would have to getting the vaccine is because there is really no long-term evidence as far as what kind of side effects this could have in 5-10 years. Is it worth it for someone my age, my health ability, to put something in my body that we don't really know what kind of long-term side effects there are?
Particularly if you've had COVID.
Particularly
Yeah.
if you have COVID.
Let's
and
set
I'm not
aside the prior COVID because
Sure.
I think there's some validity in your. Yeah, I've had COVID. I have some immunity. I'm willing to take that. There's clearly breakthrough cases,
Totally.
vaccinated breakthrough,
Yeah.
prior COVID breakthrough. So, I think people who are willing to take that risk if they've had COVID, that certainly it's a reasonable risk. There is some data to say that they might be more protected. It just depends on how much you want to be protected. Now, let's set that aside. So
Sure.
let's say the person who's never had COVID.
Yeah.
Then you have to decide, okay, yes, we don't know what the long-term risks are. Again, I'd say back to the same thing. We know what the short-term risks are of COVID.
Yeah.
People in their 30s, people in their 40s. I think there was someone in their 20s in the ICU recently. And so we do know that there is a significant health risk. It's not huge. I mean, if you took, I couldn't quote the statistics. It's a small percentage, but it's sort of like getting in I think of it, this has helped me explain it to some of my patients and to keep thinking through, because I'm thinking through this all the time. Is this worth it? I'm
Totally.
telling people to be vaccinated. Okay, how many deaths happen in the United States from car accidents a year? It's 40,000, 40,000.
Yeah.
How many deaths in the United States in the last 18 months of COVID? 600 plus. So if you take that over, annualize it over, it's about 400,000. So we're talking about 400,000 deaths. Car accidents, 40,000.
Yeah.
I put my seat on every day. I seatbelt on every day. Is it likely? Have a seatbelt ever saved my life? No, it has. I mean, I don't think it has
Yeah,
really.
you're a
I've
good
gotten
driver.
a couple minor accidents,
Yeah.
but it's never saved my life. But I still put it on because I'm not
Sure.
willing to accept the risk that I might get in an
Yeah.
accident. I may make every good choice, someone else hits me.
No,
So,
yeah, I get that.
Now, is vaccination different? Yeah, it's obviously it's in your body. There's some,
Totally.
But seat belts aren't without risk either.
Absolutely.
So, I think it's a personal decision. If
Yeah.
you decide that it's worth it for you, it's clearly less risk in the short term to have COVID vaccination.
Yeah. No, I think
to avoid
that's
the illness. And we don't have answers on the long-term effects.
yeah, and I think to a certain level, like you said, you do have to weigh it for yourself. And I love the analogy of the car as well. What is it, like a 1% chance of death? You get in your car and you die less than, or something like that. 40,000 deaths happen in your car. But I do think that the one area where I would go, where it is different, is, when you have a seatbelt on, it's not like that it's there preventatively. Whereas when you do put something in your body, who knows if that seatbelt eventually is going to tighten up and cause different issues in your body that you couldn't foresee. And for someone, again, for me, another one of the reasons that I'm choosing not to get vaccinated is because I've taken that risk assessment as someone who has been sick with COVID. I look at my current health, and then I look at long-term side effects.
Sure.
I'm 25. I don't have any kids. And it's a very real thing. The infertility rate just seems to be rising and rising and rising as far as the youth in our world. I know of people right now who are struggling with getting pregnant. Who's to say in 10, 15 years? What I mean?
I won't say that, yeah.
Who's to say? And I think it would be disingenuous to lay out a claim and say that it is safe for 10 years because
Well,
we
I don't think
know the
anyone's
truth
claiming
to that.
that. No one's claiming that it's safe.
Totally. But at the same time, that is something that, from my view, I have to take into account because in the past, based on my understanding, there has been other circumstances where mandated certain things have been rolled out, which the FDA have stamped approval on, and it's been pulled back because there were adverse long-term side effects.
Sure.
Yeah.
There's been drug recalls, et cetera. Yeah.
Totally. Yeah.
Interesting. You brought up the FDA approval, and as I mentioned, Pfizer's been approved.
Yeah.
A lot of people are upset about, okay, well, this is emergency use. I want to mention that if you get hospitalized with COVID and you get treated, guess what they're going to use? They're going to use emergency authorized medications because there are no FDA approved medications for treating COVID. They are emergency use because they haven't been studied. We don't know the long term, all the same thing. So,
yeah.
If you choose not to be vaccinated because it's emergency use, if you get it and you're hospitalized, they're going to use emergency use authorization medicines to help you.
That's good. So, if you don't mind me asking, what are? I don't know if you can speak on this, but what are some of those medications that are used?
Steroids are commonly used. Last year, that's why the death rate was really high. We didn't know what to do. It's a brand new illness. Okay, so steroids, remdesivir is a antiviral. So again, these have not been studied long term.
Sure.
But they have been shown to improve mortality.
Yeah.
There's a monoclonal antibody treatment. So that's an antibody made for that attacks the COVID virus. So that is available at an outpatient clinic. Incidentally, a few weeks ago, no problems getting people into that. So it was a license to use, emergency licensed to use in people at high risk of complications of COVID. So let's say I have a 70-year-old person who comes in, they've got diabetes, heart failure, they have COVID. I could send them there, they get an infusion, and that's actually antibodies against the COVID virus. Okay, right now, last week, there were 70 people in line for that, so we could no longer get our patient. You have to get within 10 days of infection, otherwise it's not useful. So we couldn't even get any people in there. And that line now is 125. So that treatment is not available because of the volume. Back to the volume. But that's also emergency use authorization.
No, I think that's a very good distinction because folks who maybe up in arms regarding FDA approval, emergency use during this time may not be aware that if you are sick and you do need hospital care, you're kind of what is that phrase? Biting your nose to spite, or what's spite your? I forget how to say it.
Your nose to spite your face.
It's the pot calling the kettle black kind of thing, right? It's kind of hypocritical because what you're looking at and saying, I disagree with it because it's not approved.
Now give it to me.
But now give me something else which isn't proved and doesn't have a proven track record. I think that's a good distinction and good for the listeners to know about.
So but the short-term studies show that there are some valid treatments. It's similar to the virus. It's early, similar to the vaccine. Early information. Again, we're waiting, and Moderna should be approved in a month or so. I guess their information that they first submitted to the FDA. And why didn't the FDA approve this early on, right? Well, we rely on our governmental agencies to do some of those longer-term studies. But when you're in a war, you make quick decisions. So the emergency use authorization is really addressed to, look, we have a potentially life-saving or illness-saving, et cetera, treatment or prevention that's available. We want to get it out to.
So on that FDA approval, I'm so glad that you are here, because that's another question I have. So you go on the website, you go on the CDC's website, and you see that the clinical trial expires or is finished, completed in 2023, but that it's been approved by the FDA. And so from a layman's point of view, who does not have a medical degree or anything like that, to me, it's kind of hard to wrap my mind around why the FDA would approve something if the trial for approval hasn't been finished.
You know what? I can't comment on the FDA's policies or how they. I reviewed some of it. They have longer-term studies, short-term study for emergency authorization, and longer-term studies. I can't comment. How that long-term study is going to work.
Okay.
Okay. Well, I know I have kind of one more concern that has been rolling around in my head. I don't know if you had, and I think I mentioned this to you. And for me, I love Austin has just done so much research. For me, I think I'm more relational, so my perspectives are shaped off of relations. Oh, were you gonna?
It reminded me of one thing. You said, hey, I'm assessing my risk, and I'm good. I had COVID.
Sure, yeah.
So again, let's set the prior COVID aside, because many people in our community have not had COVID. And they may be just as healthy as you. But if they pass it on, maybe. Who
knows?
But they have a significant risk of getting through it, no problem, but passing it on to someone else in their community, someone who's vulnerable, it's their parent, their grandparent, the person they work with. My 50-plus-year-old who died in December probably got it at work.
Yeah.
Probably whoever gave it to her didn't have a serious illness. I don't know. I don't know the details. But that's the other thing I just encourage people to think about when they're thinking about the vaccine. Hey, maybe I don't need it. But my perspective on the vaccine is the Bible really doesn't encourage us to assess our own protection. It really encourages us to serve others.
Sure, I agree.
So as a framework of thinking through it, how do I assess this for my own self?
Yeah.
How do I assess this in thinking about others? My family. I had a 4-month-old with it. Now that baby got better. But gosh, was that mom stressed? Yeah.
Yeah. Well,
So-
I think that what you just brought up is a very good point and a good case, I think, for people getting vaccinated, not looking out for yourself, but for other people like me. But I hate being that guy who has an opposing view. But I guess that's kind
You're
of
representing the opposing
that's
view.
kind of, I guess,
That's why you're on that side.
That's
of the
my
room.
job here, right? But so I understand the transmissibility of it and everything. But again, and I know we're going to talk about news sources and all of that, and where we get our information from. But there's a article from Spring Harbor Laboratory, approved by Yale, conjunction with Yale, and it says Delta variant is able to grow in the noses of vaccinated people to the same degree as if they were not vaccinated at all. The virus that grows is just as infectious as that in unvaccinated people, meaning that vaccinated people can transmit the virus and infect others.
Right.
And I think that that's a compelling argument as far as, hey, get vaccinated not because of yourself, but because you're looking at other people. And so I guess the area I have kind of a difficult time kind of churning in my mind is, well, if I get vaccinated, I can still transfer it just as if I'm unvaccinated, so why would I get vaccinated?
Yeah, so if you get it, you can transmit it the same way. However, you're less likely to get it.
Less likely to get COVID.
So if you do get COVID, if you get a breakthrough case, it appears that you're circulating virus at the same levels. So
Sure.
yes, you're right.
Yeah.
But you're less likely to get it in the first place.
So the back door is the same size, but your front door is smaller.
So basically, getting the vaccine. That's a good
Getting
way.
vaccine in that case protects. Yeah.
We'll go with
Ladies
that.
and
So it's a protection for you, front door. There you go.
Front door, yeah.
Instead of infecting
Yeah.
other people.
Yeah. So
Okay.
right. And you're protecting other people by not getting it in the first place.
Sure.
But if you do get it, yeah. That's why they're saying vaccinated people need to be masked now. This is. Was I really excited on the 30th? Yeah, I went on vacation. I didn't wear a mask for a week.
I'm with you, man.
I came back and the world's changed.
So I don't mean to be the one asking all these questions.
No, that's
but
literally why you have.
That's
you have
another.
you here.
That's another thing that just kind of I don't know. I'm not a doctor, and again, this is why I was so excited about this podcast. When
Well, I play one on TV, right?
Yeah, right. When I hear of getting a vaccine, right, and just generally speaking, when I go in, I get the flu shot. You have a baby, you get them vaccinated against said things. You go to college, vaccines
Right.
are required, right,
Right.
for entrance into certain
Right.
places. The assumption is from the consumer that when you get that vaccine, you're not going to get smallpox.
Right.
You're not going to
Yes.
get the flu.
Right.
You're not. Now I know that there are extreme cases and all that kind of stuff, but for, like you said, mask mandates going back on, I mean, from your perspective, as a doctor, do you see how there's a certain level of distrust from the common man to the governing authorities that what is this?
Yeah.
We're getting vaccinated, we're protected. Bad news, vaccine doesn't protect you. Masks don't work, Fauci said originally. Masks work, save them for the healthcare providers. And there's just so many different messages. And it's like, hey, if they're confused about this, then I'm not going to take a step in their direction because I don't know if they know where they're going.
Right.
So
It's tough.
I don't know if that makes sense.
Can you
but-
answer all of our questions?
Yeah, I know, right? This could be 3.5 hours, but I don't know. Like,
The way I look at it, I told you about, like, if you're playing a football game, if you're in war, is there confusion? Absolutely.
Yeah.
I mean, do you have to change your tactics? Do you learn science? I think people have an impression that science or medicine is like a stamped in stone,
Yeah.
10 commandments, here it is forever. Well, that's obviously not the case. It's changing all the time, especially in the context of COVID. I
Yeah.
mean, COVID is a brand new, coronavirus has been around a long time. Mostly they cause the common cold. So,
Sure.
I remember learning about coronaviruses, not big a deal in medical school, This is a different coronavirus. So, but it's new. So, do things change when you're learning something new? Absolutely. We all know that.
Yeah.
And in a crisis situation, things change fast. I'm sure people who have a military experience know that. And did you just hear something that now changed? Sometimes that happens. And it is frustrating. And it's frustrating when you're a physician.
Totally.
And you're trying to tell people, I told you this, and, our data's changed. And I've learned that over the years, that sometimes I tell people something I told someone 20 years ago, I wouldn't tell them now. That's just life as a physician. That's life for any of us. I mean, we
Yeah.
all give advice that we maybe change later. We learn new things. I mean, I think that's what I've been telling people in the last few weeks is because I have a lot of conversations and people, I'm not getting them to budge. But because I really do believe that vaccination is right for a number of reasons, scientifically, biblically, et cetera. But when they're resistant, I say, hey, just keep an open mind, keep thinking, keep learning, keep aware of the local situation. Because back to, what does a vaccination do? Protects me, protects my loved ones,
Sure.
protects the community, and now protects our healthcare system locally in the Rogue Valley because it is overwhelmed. And I sent Tim some references and hope maybe we can post those on our reference sheet, but a link to the New York Times map. We are in a hot spot.
Yeah.
Southern
Burning red.
southwestern, bright purple kind of. And you have to go quite a ways to get another significant area like that. We actually, the Oregonian had a article recently, just the other day, that said that we're in one of the worst areas in the nation. Sadly.
Isn't it always how when Southern Oregon makes the news, it's never for something good?
Hey, you know what? In December, we had, you probably remember this, we got on the news because we had people giving COVID vaccinations in the middle of Hayes Hill in the middle of a snowstorm.
I saw that.
That was awesome.
Okay, so when I was in college, this is a major detour, but maybe here's a break. There was our criminology students there were studying a case from Southern Oregon with Bill O'Reilly, talking about how we didn't have adequate policing in the county area, and I'm like, oh great, that's where I'm from. This is just wonderful. It's like whenever we make the news, it seems like it's always with a black eye.
We're one of the most
Right now-
lawless spots.
Man.
Right now or not,
Yeah.
it's not a good reason. That's what Wynn Howard said. We're in the national news. My mom sent me an article from the LA Times, and it said, she's like, this sounds really concerning. It said Asante's health system, in the LA Times, is one of the worst areas. Oh gosh.
Man. Yeah, here we go.
Yeah.
Well, with that, I do, and we kind of touched on it. That was the concerns, and that was great. And Austin, I know you kind of said, I hate being that guy, but
Yeah.
I think there's a lot of people sharing those concerns. And being sensitive to our time, I want to go into our last bit, and it's the information that we're hearing, because
Can I address one thing?
Yes,
real quick?
you can.
So there's been concern from the Christian community about aborted fetuses,
Oh, yeah.
fetal cells
Yeah.
in the vaccines, and if that's a reason for people to say, hey, no, this is ethically not appropriate. Again, I've read through the information. There are no aborted fetal cells in the vaccines. Now, were there some what's called a fetal cell line? So these are the information says that they are using cell lines. So these are thousands of generations of cells from a fetal tissue in the 70s. So it was an abortion. So that tissue
Interesting.
has been kept alive. Not tissue,
Preserved.
cells.
I got you.
Cells,
Yeah.
not tissue. It's
I
not
got
fetal
you.
tissue. It's
I
not an
got you.
organ. It's not anything like that. And I'm too far removed from the molecular biology to say how that happens. But cell lines are kept alive, and are used to test vaccines. So that's the mRNA vaccines are used that. So they use it after the production of the vaccine to test the vaccine in a cell culture, effectively. In the J&J vaccine, they did use fetal cells in the production of the vaccine. Now, here's the way I think of this. If I needed a transplant and I was on the operating table and someone said, hey, we got an organ for you, here it is, but that person was murdered. Are you going to accept that organ? Do I say no? I don't think I would be condoning murder by saying I would take that organ. What has happened has happened. Who spoke this weekend?
So I taught in Rogue River. Andy taught at Redwood.
I watched online, Mark.
Mark downtown.
So
yeah.
it was
the
about
big dog.
The big
setting
dog.
aside what's in the past. I press on for it. So I guess I'm just using that because I thought of this because I was thinking about this talk we're going to have today.
Yeah.
Fetal cells. What does this? If I get the vaccine, am I condoning abortion? Well, that happened 50 years ago. I can't do anything about what happened 50 years ago. Can God turn something that was not good into something good? No question. I'm reading the Genesis. Joseph said, "What you intended for evil, God intended for good, to preserve life."
Yeah. I can completely see though why there are those hesitations, because I don't like that. Like even the cells of an aborted baby, that rubs me the wrong way, because as far as I'm concerned, those cells were placed there by a divine creator who knit that baby in the woman's womb. It's like that to me is like, oh gosh, can't you use something else? Like why? Like is there something about
I can't
that?
answer how the technology is, but that's the reality.
But that does kind of weird me out. I mean, just flat out, because that is a baby. It was a baby in the 70s or wherever it was. Like that was still a child created by God. I don't know. And
so in the thought experiment, would you still have trouble accepting an organ from someone who'd been murdered?
maybe a murderer, not murdered.
Okay, so that's the question. So
Yeah.
I mean, if you're going to consider this, I mean, to me, it's the same thing. And
Sure.
actually,
It's
I
a
came
helpful
across
example.
Yeah.
Yeah.
I came across an example. Someone had also posted that kind of thought process in a Christian format.
That's really
These
good
are not
for thought.
easy questions.
No.
right?
No, they're not. Yeah, not for an hour podcast.
and I appreciate your willingness to address them and not feeling like we need all the answers, but at least being able to give some insight from a medical.
Yeah, and I think that's a biblical perspective. I mean, not only a medical perspective,
Well,
but
right.
a biblical perspective that God turns the ugly into the beautiful. That's grace.
Yeah, and now that I think about it, I said the murderer, not the murdered. I
Yeah, you
didn't
said
mean
you
that.
wouldn't take an organ from a murderer. Which,
Yeah. Well, I was just thinking about it, and I'm like, the murderer. No, give me Jeffrey Dahmer's liver. like what?
All right. Well, speaking of rabbit trails, yeah, if you have any questions, email us, because that one was weird. But guys, let's spend a few minutes on sources, because I kind of joke with people that I feel like if I wanted to make a case why the vaccine could turn you into a dinosaur, there are resources out there that could very poorly back my argument. And so, and again, you both, what I love, a lot of reasons I love about you, you are researchers, you are going to dig into things. So I know you have resources. Dr. Williams, though, what are the things we should be staying away from? I'm going to guess one of them rhymes with Rocholredia. But yeah, just a quick discussion. Austin, you look like you had something.
I have a hilarious example.
Can I say so
Yes.
real quick? I gotta go. I got a bunch of high school kids waiting for me.
okay, cool.
But yeah, I would just say that anything that is explicitly partisan gives me a little bit of a red flag.
Okay.
And so I really respect people who are able to just kind of break out of the partisan box a little bit and so that's helpful for me. But
All right.
yeah, hey, really appreciate you being on here, Dr. Williams, and thank you all for whoever's lasted this long.
Yeah.
You know?
Tyler, exit stage right.
Drop the
This is
mic.
long.
Yeah, we're
Drop the mic.
You are the weakest link. Goodbye.
Yep, you've been voted off the island.
All right, Austin.
No, so I texted Tim this. I thought this was hilarious, and I figured you'd probably get a kick out of this, the people listening. So it just made me laugh. Both articles, major news sources, posted on July 30th. There is the New York Times and there is the AP News, all right? So 2 major news publications, both citing the same study, okay? New York Times headline, and how many people read the headline and not the full story, right? Probably most people.
Millennials.
New York Times headline, vaccinated people may spread the virus, though rarely, CDC reports. Okay, so that's the headline as of July 30th. They may spread the virus. AP News, vaccinated people carry as much virus as others.
Yeah.
What?
Yep.
Yeah. I'm not going to answer for the editorializing. I will say
Totally.
that I there is a map that's available, and whether you trust the New York Times or not, I think the data. So there's a map that
Yeah,
we
I
talked
think
about.
we can maybe even get it on the screen when we talk about
And that's
it.
really helpful. It is updated every day. It's something that I consider that it's simply a data feed.
Yeah.
How many cases are happening in each county? You can look at the entire United States, every county. So I think that's got some helpful information. The Oregon Health Authority, again, is it a government body? Yes. I get an update every day on that, and it does tell you what's going on in Oregon. Asante has a website, which if you look at the Asante website, they have a COVID information, tells you how many patients in the hospital in their 3 systems, how many patients in ICU, how many patients on ventilators, life support. So there are some resources locally as well. I looked up a couple information. Johns Hopkins Public Health has a pretty reliable, reliable. It's one of the leading public health and medical schools in the country. Harvard Chan School of Public Health would be another one. So these are places you could get good information, and that may be more information than some of our listeners might want. It may be less than others want. Certainly those are going to be in a format that's addressing public health issues and things like that, and they're not local, but they do have patterns for the for thought processes and how do you think through some of these things.
It's very, very, very fascinating to kind of dovetail on what Tyler was saying. He talked about partisan editorialization. The other thing that I think is also really important is not just reading the headline, because editorialization is a very dangerous weapon that is I believe used and wielded by different organizations to try to push or encourage a certain agenda. So that's one thing that I would say is dig just a little bit.
Dig deeper,
Dig
perhaps?
deeper. Whoa,
let's go.
Dig. Make him a regular. Tim.
Yeah.
Dig a little bit deeper, right?
Yeah.
Because headlines can be so misleading.
Go to the source.
So that's one thing that I would suggest. And then you kind of discussed this, but maybe I could kind of reemphasize something you said. The value of reading articles that are peer reviewed. I think having different medical doctors and physicians who've signed off on something saying that this is good science, I think is valuable. Now, again, I was reading an article about how peer reviewed has lost some of its power because politics has increasingly become personal, and then they get in their own echo chamber of who they have peer review, and then they get signed off. But nonetheless, I still think we have to value something.
Certainly, more people are smarter than one.
Totally,
No question.
absolutely.
And you mentioned social media, and I would just stay away from social media as a source of reliable
Facebook charts.
information on this. It's just you have to use some sort of filter, and I'm going to trust the medical community. Is the medical community perfect? I said nope. We were missing things here and there. We're changing as the pandemic changes, but we're gonna. I've committed my life to serving in a medical setting from a biblical standpoint.
Yeah. Speaking of biblical standpoint, I feel bad. We almost need a part 2 because I would have loved to have talked a few things from like a spiritual, pastoral.
Yeah. No, there's definitely a few things, but who knows? Maybe this isn't going away anytime soon.
Well, yeah, I think it's one thing that I appreciate about that you said so much at the beginning is the role of like shepherding people and encouraging people. Maybe Tyler said that. I don't know. Maybe none of us did. But I think that we do have a role, and I also value the idea of being able to sit down and have conversations where you do disagree and be able to walk away from them, not doing passive aggressive, drive-by, slanderous, childish acts, which is what you see on social media, and be able to go, Tyler, I may disagree with you on X, Y, and Z. That doesn't mean you suck. That doesn't mean you hate people. That doesn't mean you're unloving. That doesn't mean that you are a murderer. It means we may disagree. And that's okay, I think. I don't know. And that's an area where I know that there's discussion and there's kind of dissension on, because I had a conversation this week with someone who makes the claim that it is completely unloving and not justifiable at all for a Christian to be unvaccinated, and that it is murderous. I take issue with that, but that's probably another hour.
Yeah. Yeah.
So
And I don't mean to do this, but I do have a 3 o'clock and it's 3:05.
Okay.
So
can we encourage our listeners to talk with a trusted healthcare provider? If they, if they have questions about the vaccine, talk to your doctor, talk to your nurse practitioner, physician assistant, whoever you trust. Please speak with them, get their opinion.
Okay.
bingo.
Awesome. Well, speaking of trusted healthcare provider, thank you so much, Dr. Williams. Austin, thank you for everything you've done. Tyler, thanks for bailing on us again. Listeners, catch us back next week here on Digging Deeper. See you guys later.
Yeah.